Stress isn't sweet, but it may still give you diabetes. Dr. Roberta D. Baer is a teacher and researcher who specializes in applied medical and nutritional anthropology. Her work primarily focuses on health disparities and determining non-biomedical factors that influence overall well-being. Groups she has done most of her research with include Burmese refugees living in the United States, Latinx people in Mexico, Peru, Bolivia, and Ecuador, and college students in the US. Dr. Baer has written over 50 articles, book chapters, monographs, book reviews, and technical reports. She's a distinguished and respected living female anthropologist. Before we really get into this, here's some background. Medical anthropology studies how health and illness are shaped and perceived in cultural contexts. One of the many things applied medical anthropology studies is the link between ethnomedical illness and biomedical illness. In traditional Western medicine, ethnomedical illnesses are widely ignored when thinking about causes or etiologies of biomedical ailments. Dr. Baer's work is expansive and diverse, but in this presentation we will be focusing mainly on her work in Mexico, where she and her colleagues examine how self-diagnosed folk illnesses correlate to type 2 diabetes. Their research question is, are people who have experienced susto or nervios at higher risk of diabetes? Susto and nervios are folk illnesses that are often brought up in explanations of the etiology of diabetes by Mexican and Mexican-American diabetes patients. They both have to do with psychological stress. Susto is similar to how Western culture defines PTSD, and that it is brought on after traumatic experience. Symptoms of susto include agitation, sleeplessness, extreme fear, and general discomfort. Nervios is more of an umbrella term for many ethnomedical illnesses, whose symptoms include sleepiness, trembling, and depression. Type 2 diabetes is a disease whose biomedical etiology includes obesity, lack of physical activity, and inability to properly control insulin production. In some Latin cultures, ethnomedical etiology includes susto. The belief is that if untreated, aggression and anger will lead to type 2 diabetes. According to this study, in Mexico, susto is widely reported to cause diabetes. While nervios is not immediately connected with diabetes, it is widely associated with a higher morbidity rate. Medical anthropologists use ethnographic research methods to conduct their studies. They also draw from other mixed methods, including quantitative and qualitative data analysis. In this particular study, participants included patients of a clinic who had been diagnosed with diabetes at the age of 30 years and older, as well as another population of patients with 30 years and older who were from the same clinic but had not been diagnosed with diabetes. The participants of this study were all asked 3 questions. 1, do you believe that one cause of diabetes is susto? 2, have you suffered from susto? 3, have you suffered from nervios? The patients diagnosed with diabetes were then asked an additional question. Did susto cause your diabetes? After the interview process was over, glucose levels in the blood were tested in all participants. More than 2/3 of diabetic patients surveyed reported having experienced susto in the past, and half of those patients had experienced nervios as well. When asked if susto caused diabetes, 51% said yes, 20% said it might, and 29% said no. However, the question, did susto cause your diabetes, flipped the responses. Most responded with no. A control group who comprised 1/5 of all who were surveyed were not diagnosed with diabetes. Some of those in the group were later diagnosed with diabetes, separate from the study. 55% of participants with undiagnosed diabetes and 72% of those without diabetes reported experience with Susto. Essentially, respondents who had reported to have had Susto had a 0.35 lower risk for diabetes than respondents who had not experienced Susto. As for patients who experienced Nervios, risk for diabetes was 0.93 less. In addition, comparison of blood sugar levels between patients who experienced folk illnesses and those who didn't indicate average blood sugar levels not to be higher among those with folk illness experiences. In conclusion, the team's hypothesis was proven incorrect. If Susto were a risk factor for diabetes, we should have seen higher prevalence of Susto among those with undiagnosed diabetes or among those with a recent diagnosis of diabetes, reports the team. While much more can be done to test the effects of biomedical etiologies, understanding perceived association between folk illness and biomedical illness is a crucial first step in that study as a whole. Flaws of this study include the small sample size, less than 1,000 people in total were surveyed, and the fact that it's difficult to determine the timing of psychological stress in the group with diagnosed diabetes, since it's widely known and accepted that people with clinical diagnoses tend to carry more stress than the average healthy person. As with any study conducted by interview, it's also important to note that people's responses to questions don't always match up with their actual symptoms. These findings reaffirm distinctions made by another group of anthropologists between bio and ethnomedical illness 30 years ago. The contribution of qualitative data to this particular field is also important for future hypotheses to come. Finally, this study contributes to the body of ethnomedical and biomedical paradigms within the Mexican/Mexican American tradition.